idea. I am so smart, suddenly it just appeared. There's a light above my head, sometimes white and sometimes red. Bright ideas make it glow, and very soon the rest of the world will know. I just came up with a really bright idea. I am so smart, suddenly it just appeared. I just came up with another bright idea. I am so smart, suddenly it just appeared. There's a light above my head, sometimes white and sometimes red. Bright ideas make it glow. Well, hello. Good morning or good afternoon. How is everyone doing? Let us know in the chat how everyone is today. Hopefully you're having a wonderful week. We want to welcome you all to our YT course for advanced coders. We are on week 5. We will be covering urinary and the male and female section this week. So I'm so glad you all joined us today. I know so many of you, I'm recognizing you coming back week after week. So we want to definitely say thank you. And if you're joining us for the first time, you can go and catch the playbacks for the previous weeks that we covered. So again, we want to welcome you all. And we do have a winner for our lecture series, and that will be announced at the end of class. So stay tuned for that. We are so excited to announce our winner. And for those of you who've been asking about, getting more information with AMCI, learning a little bit more, feel free to come on board with us. Go to our website at amcicoding.com. You can go ahead and click on courses up at the top. And we have 2 courses here, our lecture and fast track series that would be perfect for you. They are on monthly subscription, so you get those lecture series. You can study on the go. Depending on which one you get, you have access to our private lectures in both. In fast track, you do get some final exams. These are both mobile device friendly, and you also will receive a certificate of completion if you go with the fast track course. Okay. And I want to introduce the wonderful team joining us here in the chat. Go ahead and say hello to Miss Angela, Miss Sarah, Miss Tiffany, Miss Valentina, and Miss Jody. And joining us on our instructional side today, we have the wonderful Miss Rochelle. She is our Partnership and Marketing Director. Hi, Miss Rochelle. How are you doing?
Hello, Miss Tracy. I'm doing great. How are you?
I'm doing great. Thank you for asking.
Wonderful. Oh, and actually, Miss Tracy, I just realized we're actually in week 6 today. Can you believe it? So we're actually in week 6, and I need to fix that thing over there. But hey, coders, how are you? Are you enjoying this class so far? I see you guys in the comments below, and please do keep those comments coming, and let us know what you think about this class. And today is gonna be a good one. I think we're gonna have fun learning about the guidelines, and of course we're bringing in some great scenarios for you guys to solve too. So I cannot wait. Let's do this, Miss Tracy, and thank you so much for the introduction.
Thank you so much, Miss Rochelle. And yes, we are on week 6. I can't believe it. Wow, we are on week 6 already. So thank you, Miss Rochelle. And we have the wonderful, lovely Mrs. J joining us today. She is our awesome curriculum director here at AMCI. Hi, Mrs. J. How are you doing?
Hello. How are you, Mrs. Tracy?
Doing well, Mrs. J. Thanks for asking.
Awesome. How are you, coders? Are you ready to get started? Well, if you are, that's great because I'm ready too. I'm going to Miss Tracy, if you can just go ahead. Thank you so much. I'm going to show you my screen and I want to talk to you about the AMCI lecture series. We've already had one winner and it's time to announce the next winner. So, and if you don't win today, we're going to announce today at the end of this presentation, we will announce the winner. But for today, if you would like to win the AMCI lecture series, that means that you're going to see all of our content, all of our private lectures. You'll even get to see our E&M. You'll get to see our ICD-10-CM, and trust me, it's gold. So congratulations in advance to our winner for week 6. And if you want to be week 7 winner, here's how you enter. Go ahead and comment on the video below. Gotta let us know what you learned today. Then in the link, in the chat, live chat, we're going to give you a link for you to register. All right. And it's important. You got to make sure that you like us on, well, like this video, subscribe. Like and subscribe. If it speaks to you, do that. Tell other people. The more people that you tell, the longer that we will continue offering these types of instructions. So tell everybody, don't keep this a secret. Tell everybody, we want to know that this is good for you. We want to know. And the only way we know is if you're watching these lectures. Okay, so tell everybody to watch. All right, I got a question for you. This is just to kind of get your fingers going. How confident are you with urinary male female CPT guidelines? Go ahead and type in the chat. If you're very confident, write it. If you're somewhat confident, write it. If you're barely confident, write that too. Or if you don't know if it's something else, go ahead and write that as well. All right? All right, so I'm going to move on. I want to just remind you about the class rules. Remember, this is an advanced class and the pace will be accelerated. And if you are currently in a comprehensive course, this is the perfect course for you. It's a good supplement. And if you're a new coder, this course may not be for you. We do have something for you. Go ahead and look in our discussion or description box just below this. I guess after today, it'll be a video. So we'll call it a video. So just below this video, and go ahead and contact our customer service to find out about how to register for our free introduction to medical coding course. And I believe it's coming up soon this week. Um, Tomorrow. Yeah, so get in there and get registered really quickly. All right. Feel free to watch playbacks at any time. Like I said, have your friends watch. They can watch the playbacks. If they can't make the live session, watch the playbacks and tell them to keep watching. And don't forget, we do have homework, and that homework will be available in the comments section, and we will give it to you in the live chat. That link will be available for 24 hours. And remember, students should already have some experience with CPT guidelines because class will move at a faster pace. All right, so goals for today. We want to review guidelines for urinary male-female section of the CPT manual. Number 2, we want to provide you with scenarios to further clarify the more complex guidelines. Number 3, provide CPT documentation tips. And you know what? We are the creators of CHUN, so we just may give you some CHUN tips. And 4, demonstrate the importance of forensic reading. Okay, coders, do you know what forensic reading is? Well, At AMCI, we teach our coders to be forensic readers. That means read very carefully and learn how to select the keywords to get to the correct code or correct answer. And don't forget, coders, this class will move at a faster pace than usual. And if you're new and you want to know why I keep repeating it, because people they enter class at different times, and we just want to make sure that you know. And those of you who are here for the first time, you may not have seen it before. So don't want to be redundant, but we do want to be, it's the proper thing to do to let you know that we are going to move kind of fast. All right. The outline for this course, well, this is a 10-week course, and week 1, we studied integumentary. Week 2, musculoskeletal system. Week 3, respiratory. 4, cardiovascular. Week 5, digestive. Week 6, and that's this week, urinary, male and female systems. Week 7, nervous eye ear. Week 8, radiology, anesthesia. Week 9, pathology. Week 10, medicine. All right, what we will not cover are evaluation and management and ICD-10-CM or PCS, because it's just those two subjects are very comprehensive and we just don't have enough time. Again, class will move at a faster pace than usual. All right, I just want to let you know that if you have a question, go ahead and type your question in that chat box. Keep in mind the instructor speaking is unable to see your question. That would be me. I can't see you right now. However, several AMCI instructors who are not speaking are standing by to answer your questions. You'll be able to identify AMCI instructors as their name should read. AMCI instructor, Mrs. J. AMCI instructor, Ms. Rochelle. AMCI instructor, Mrs. Tracy. And you'll see there are several AMCI instructors on hand to help you. And yeah, when I finish speaking, I'm going to go in the chat and I'm going to assist. All right, so ask away. Next, copyright. CPT is copyright of the 2019 American Medical Association. All rights are reserved. CPC is a registered trademark of the AMCI, AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept, FTR, CHUN, AMCI Fab 7, Flip, Tap are all trademarks of AMCI. All right, so we are going to start out like we always do because the name of this game is surgery. We're talking about surgery subjects or surgical chapters each week. And this week, we're going to discuss urinary male-female surgery, and the general surgical guidelines apply, specifically the CPT, surgical package definition. Remember, the CPT code includes some other items in addition to the surgery. Those 6 items are here. The evaluation and management services, the day before and the day of surgery. Local infiltration. I'm going to put the pause on. Local infiltration or topical anesthesia, that's bundled into the code. Also, immediate post-operative care, including dictating operative notes, talking with the family and other physicians or other qualified healthcare professionals. Writing of orders is bundled into the code. Evaluating the patient in the post-anesthesia recovery area. And finally, typical post-operative follow-up care. You know, that follow-up period, that too is bundled into the surgical package. And what does that mean? That means you don't code it separately unless there is an extenuating circumstance for you to do it. And if you do code it separately, you will need an appropriate modifier. The next general surgery guideline that's relevant and that you should know is the guideline of separate procedure. Separate procedure is a code that and in the description, it's denoted as separate procedure, and you'll find that term, separate procedure, in parentheses. And when you see a separate procedure, I say always highlight that separate procedure. If you need to put asterisks next to it, make sure you pay attention to separate procedures, because separate procedures can be coded by themselves, and they should be coded by themselves unless there is a circumstance. So typically, separate procedures are coded by themselves. Now, if you the circumstance where you can code it with another procedure, you can code it as long as it's not related to that other procedure. Okay, so if it's related, how do you know? In the same body area, in the same surgical site, something's got to be related. If it's related, then you do not code it. If it's not related, then go ahead and code it and make sure you append modifier 59. All right, I think I've beat that horse to the ground. I think I've just said it over and over. I think you all have it. All right, don't forget, coders, trust your guidelines. That's what this is all about. Guidelines. Remember, your parenthetical guidelines are the supreme. These are the guidelines that you'll find in parentheses. See? That's a parenthetical guideline. Second, you have code series or chapter guidelines, and you'll find these at just before the code series, and you'll see it right underneath the blue bold. And third, you'll have your general coding guidelines, and these are the guidelines on the green pages. Now, in terms of hierarchy, in terms of ranking, your parenthetical guidelines outrank them all. They take precedence of them all. So if your surgery guideline says one thing, your parenthetical guideline says something else, you're going to follow the parenthetical guideline. And then if you have these code series guidelines, they can take precedence over your surgical guidelines and so forth. Now, if there are no guidelines, trust your keywords, because they do rule. And also, too, keywords do work whenever you have guidelines. You're just going to have to know how to use it. All right. So this is a reminder. If you like our instruction, please like this video, subscribe to this channel, and tell everyone about us. The more people watch, the more videos we can make. And this is how you do it, right up underneath here. You can like it and subscribe. And thank you in advance. Okay, so here we are. We're going to talk about the urinary system. We're going to talk about the urinary male and female systems. But here's a good picture of the male and female systems and the urinary system. And as you can see in this image of the male and female system, the urinary system is the exact same, of course. What distinguishes the male and the female, of course, are our reproductive organs. All right, so it's important that you know the difference. And let's go ahead and let's turn our attention to the table of contents. All right, so when discussing the urinary system, code series 50010 through 53899, you will find that the anatomy of the urinary system is from superior to inferior. So the thing that is the highest situated in the body, that is first. It is presented first in your table of contents. So, and also in your chapter. So first, we will discuss kidneys, the incision, excision, the transplantation, repair, laparoscopy, endoscopy, and other procedures, followed by your ureter. The ureter procedures are very similar. You've got your incision, excision, introduction, repair, laparoscopy, endoscopy, and your bladder. That is down further. And then you've got some other procedures too, but you get the picture. We're going from superior all the way down. All right. Now let's take a look at the anatomy. And also too, oh, here's your urethra too. The urethra is the hole where the urine exits. So let's go ahead and let's talk about the anatomy really quickly. And the anatomy of the urinary system is so straightforward. It's difficult not to really know. So you've got your kidneys, your right kidney, your left kidney. You have your ureters. You've got 2 ureters and 1 bladder and 1 urethra. And a lot of people confuse ureter with urethra, and our resident anatomy instructor, Ms. Carney, she reminded me to tell you all that you will be able to distinguish ureters from urethra because ureters have 2 E's and you have 2 ureters. Urethra has 1 E, you have 1 urethra. So that's one good way to remember it. And you got your kidneys, the urine is produced here, and then down, the urine goes down into the ureters and it sits in the cyst. The cyst, yeah, the bladder. That's another word for bladder. What is a cyst? It's a sac with of liquid, and that's exactly what your bladder is. All right, so we're going to move on. You know what? I think we're ready for, yeah. I just want to talk to you a little bit about some guidelines, and then I'm ready to roll. All right, so wait, did I miss something? I did. We're going to talk about transplants. And these transplants involve taking a graft. A graft is, something that is used as a supplement to something. But kidney transplant or renal transplant is the organ transplant of a kidney. Now, usually the patient has end-stage renal disease. And if you look at these pictures, on the left, this is the donor, and on the right is the recipient. They removed the left kidney from the donor and transplanted it into the recipient. And as you can see, look at these diseased kidneys. They're still intact. They did not remove them. So this patient did not, the recipient did not have a nephrectomy. The diseased kidneys remained. And then they took the transplanted kidney and anastomosed it to the anastomosed it right down in this is a unique area, and they put it right in the vessels right above the bladder. Yeah, near the iliac area. All right, so this is really interesting. This kind of caught me off guard just a little bit because even though I've seen this before, but I'm studying how they put it all together. So let's get back on track and let's review the guidelines for coding these transplantations. All right, so you could potentially have 3 procedures that you're coding for. Number 1, you have to code, you're going to have to code for the cadaver donor nephrectomy. Either it's unilateral or bilateral. Either that graft or that donor kidney is going to come from a deceased person, and that's referred to as a cadaver, or a living person. Number 2, the backbench work. This is preparation of the graft, the recipient graft. So they're not doing this backbench work on the this is on the donor. The backbench work is performed on the donor, not the recipient, okay? Now, why does it say recipient here? Okay, I'm moving a little too fast. Ms. Tracy, if you can change that, I'm going to change it right now. And we do this from time to time. Because if people are, if people are screenshotting, I would like you to have the correct information. So that is the donor. Backbench work is performed on the donor, and I'm going to talk to you while I'm changing this if I can. But it's performed on the donor, and they do things like, did I spell it right? DONOR? Okay, hopefully it is. All right, I'm going to put my screen back up. It's not letting me. Come on. Okay, 1 second.
It on my end, Mrs. J.
Yeah, it's there. Thank
Okay.
you. Thank you so much. All right, so here we go. All right, so the backbench work is performed on the donor, and what they're doing is standard preparation. What is standard preparation? This includes dissection and removal of the perinephric fat. So that is fat around the kidney, diaphragmatic and retroperitoneal attachments, excision of the adrenal glands. Yeah, those adrenal glands sit right behind the kidney, so they have to take those off, and preparation of the ureters, the renal veins, and the renal arteries, ligating branches as necessary. You're going to use 50323. So backbench work can really be intense. So we've got a couple of backbench codes, 50323, 50325, and then we've got a reconstruction code. So this is a little more than backbench, but it's reconstruction. You've got 50327 through 50329, and then finally the recipient allotransplantation. So the transplant. And the codes that you would use would be 50360 through 50365, and you can find these guidelines on page 358. And coders, those are your guidelines for coding transplants, and I think we're ready to do a scenario. You ready? All right. The answers: A, 50365 50 modifier, 50300 50 modifier, 50325 50 modifier, B, 50365 50 modifier, 5030051, 50323 51, C, 50365 50 modifier, 50300 50 modifier, 50340 50 modifier, 50323 50 modifier, and D, 50365 50 modifier, 50300 50 modifier, 50323 50 modifier. A 48-year-old retired school teacher with end-stage renal disease presents today for bilateral nephrectomy and bilateral kidney transplant. A donor has been secured, a victim of a fatal motor vehicle accident. The transplant team carried out the following procedures: bilateral nephrectomies of the donor and recipient, donor backbench work, and allotransplantation into the recipient. Which of the codes best describe this encounter? Okay, coders, I'm going to give you a minute and a half. Okay, coders, how did you do? All right. If you said B, outstanding. All right, coders, let's see what we did. The first thing that we did, we highlighted our keywords. For the 8-year-old, end-stage renal disease, bilateral nephrectomy, and bilateral kidney transplant. Now, we have a donor that had been secured he was a victim of a fatal motor vehicle accident. So that means this is a cadaver. And the following procedures were carried out. Bilateral nephrectomies of the donor. So they removed the kidneys from the donor and the recipient. So unlike that picture that we had earlier, they took the recipient's kidneys, they removed those. They also performed donor backbench work and allotransplantation into the recipient. So it's really important to understand what took place. All right, so our first codes. We know this is an allotransplantation, and the parent of 50365 says renal allotransplantation, which is an implantation of a graft, but 50365 is the code for with a recipient nephrectomy. Okay, and if you look at the parenthetical guidelines below, it says for bilateral procedure, report 50365 with modifier 50. And that's exactly what took place. We had a bilateral allotransplantation with bilateral recipient nephrectomies. Okay, so we know that A, B, and C and D's first answer is correct. But when we get to 50300, donor nephrectomy, we like that code. From a cadaver donor, we like that. But this unilateral or bilateral, anytime you see or, that is a game changer, because you should always look at it again. So if this code can be used for unilateral or bilateral, then that means that you do not need a bilateral modifier. All right, so if we're looking at codes with bilateral modifiers, A, C, and D are all incorrect. So we've just solved the scenario. But let's go ahead and do our due diligence. And 50325, this is the code for backbench work. That's incorrect. And you know why it's incorrect? Because it's the backbench work for the living donor. And remember, our donor is deceased and is a cadaver. So A is wrong on many levels. Also, 50340, this is the code for recipient nephrectomy, and it's a separate procedure. Remember, we talked about separate procedures? We're not going to code anything that says separate procedure if it's related to a more comprehensive procedure. So we're not going to code it in addition to a more comprehensive related procedure. So therefore, just on the separate procedure rule, we know any answer that has 50340 is incorrect. So that is going to, wow, that should eliminate C, but let's keep going. All right, so now we've got some donor backbench work that we have to code for. And this donor backbench work, that's for a cadaver. So 50323, backbench work, standard preparation for a cadaver is the correct code. So that parenthetical guideline is not applicable, but it's important to read. And C is incorrect because it's coding for a living backbench work donor. And we're going to eliminate C And B is our answer. Okay, coders, if you got that correct, outstanding. However, if you learned something, that is priceless. All right, so you know what? I said that there were three, well, there are three typical procedures that you would be coding for in an encounter. So a minimum of three, or it could be a minimum of three. But three major ones that you could be coding for. You could code for two, you could code for one. However, it's important that you know what you're coding for. Just take a minute and look back and think, what am I coding for? And you should do fine. So let's go ahead and let's solve another scenario. I think you can do it. All right, answers. A, 5036551 modifier. 5030051 modifier. 5032351 modifier. B, 50365. 5032151. 5032551. C, 50360. 5032051 modifier, 5032151, and D, 50365, 50321 with a 51 modifier. A patient with kidney failure presents to the operating suite for transplant of his left kidney. The patient's cousin is a perfect match. The left kidney is removed from the cousin and taken for backbench work, reconstruction. The patient undergoes a nephrectomy. Then the donor kidney was transplanted in the recipient site. What procedure codes are reported for this encounter? All right, coders, you have a minute and a half. All right, coders, how did you do? I know you did well. All right. Hey, I got a question for you. On site, on site, there is an incorrect answer. A, B, C, or D on site. You should be able to say that one of these answers is wrong. And I'm just going to tell you. Look at A, 50365 with a 51 modifier. A 51 modifier is appended to the first code. 51 modifiers denote multiple procedures. And you cannot append a 51 modifier on the first code. It becomes a multiple procedure after the first code. All right, just first procedure. Right? So you can never put a 51 modifier on the first procedure. It becomes multiple after the first procedure. So you should eliminate A right then. All right, so let's figure out what happened. This patient, I'm not going to tell you the answer. I'm going to tell you after this time. This patient had kidney failure, had a transplant of the left kidney, had a cousin who's a perfect match. And let's assume that cousin is still alive. They removed the kidney from the cousin, then backbench work, reconstruction took place, and then a nephrectomy. The patient had a nephrectomy, and then the donor kidney was transplanted. So what we're going to code for are nephrectomies. Okay, so the nephrectomy of the donor, nephrectomy of the recipient, backbench work of the donor, and transplant. That's what we're going to do. So let's go to our next slide and let's go ahead and solve this scenario. All right, so again, we had a nephrectomy. The patient had a nephrectomy, the recipient, as well as the donor. And so if you look at 50360, this is the code for renal allotransplantation implantation of graft without recipient nephrectomy. We know that the recipient did have a nephrectomy, so we're going to eliminate C. All right, and that leaves us with A, B, and D. And our code is 50365. We know that's correct. Now, the kidney is removed from the cousin. We're assuming the cousin is alive, or if the cousin was deceased, it would have been noted. All right, so the next code that we're looking at is 50300. It's coming up red because it's incorrect. And it's incorrect because this is the code for donor nephrectomy, including cold preservation from a cadaver. So we're not coding for a cadaver, we're coding for the living donor. Okay, so A is incorrect. 50320, this is the code for the living donor. We know that's correct. Now, the difference between B and D is 50325, and this is the code for backbench work. Yeah, backbench work did take place right here. See, backbench work reconstruction took place, 50325, and it's for backbench work on the living donor. And D is incorrect because it's missing the backbench work, and B is our answer. All right, coders, how are you? Are you transplantation coding experts? I know you are. I know you are. Well, if you still have questions, go ahead and place them in the chat. I'm going to join you momentarily. And now I'm going to turn it over to Ms. Rochelle.
Yes, thank you, Mrs. J. Wow, that was a great discussion. I know for one, I'm very interested about this transplantation. Isn't it amazing? Very interesting. And the good thing is, as coders, we don't really have to do all that. All that work. We just have to code them. So loved it. Thank you, Mrs. J, for that wonderful, wonderful discussion. Okay, but I think at this point we are going to talk about a minimal procedures this time. So we're gonna go back and talk about scope. So are you all ready? So this one is I kind of find this one the fun one to code. But all right, so there are several, as we know, there are several scope procedures throughout our surgery section in our CPT manual. But under the urinary male and female reproductive sections, we're gonna talk about mostly at this point really is the renal scope. So let's go over it quickly. So the renoscope is what you see here on your screen is a procedure in which a small scope, usually like a flexible telescope, is inserted into the bladder and ureter, in this case actually in kidney. And they use that to diagnose and to treat a variety of problems in within the urinary tract. Now, there are several scopes, like I said, you will find when you're coding under this section, but let's go ahead and just have a few examples here. You will find that you will be coding cystoscope here in this section. And basically, a cystoscope is a test or a scope wherein the doctor would test, and insert a scope in order to check your urethra and bladder. Okay, so remember, Mrs. J said a cyst is, you know, now I'm getting my brain froze again. So a cyst is a bladder that consists of water inside it, something like that. So, and that would be your bladder. So that is what you call a cystoscopy. So basically, a cyst will be inserted all the way through your urethra and throughout your into your bladder, and they will check over here. Okay, hopefully that makes sense. Another type of scope that we might be coding under this section as well is what they call as the uterus. I can never say this. Ureteroscope. Okay, so a ureteroscope is when the doctor actually inserts the scope um, to your urethra and goes up to your bladder and then go all the way to your ureter. Okay, so usually when a patient has trouble in peeing, sometimes they complain about pain. They could possibly have some kidney stones, and usually this is the scope that they are going to use to diagnose if the patient has some kidney stones in the ureter or any other signs of trouble. So I think that's just a little bit of good examples. But like I said, there's several scopes that we are going to be coding from this section. But as far as the guidelines, as it goes with the rest of the surgical scopes, basically it just goes with two things. So there are two things we need to pay attention to when coding for scopes. First is that the diagnostic scope is going to be bundled into the surgical scope. And you will find that as an example here for your laparoscopy for your kidneys. So also, you have to pay attention to the separate procedures as always. You have to make sure that those separate procedures are not going to be coded if they are a part of the more complex procedure. Okay, and that's it. So just watch out for the separate procedures. And we have another illustration here, the laparoscopy in this case for the ureter. Same goes. The guideline is still the same. Always remember that the diagnostic scope is going to be bundled into your surgical scope. And again, watch the separate procedures. That's it. So easy, right? So I think we are going to go ahead and dive right into our scenario next. So if you're ready, let me read to you this scenario here. Your answers, we have A, 52214, B, 52235, and 52000 with modifier 59. For C, you have 52240 and 5200 with modifier 59. And for D, 52240. A 40-year-old male carrier with symptoms of urinary frequency and blood in the urine for several months has recently been diagnosed with a 6.0 centimeter bladder tumor. The patient is here today to undergo a diagnostic cystoutheroscopy to see how the tumor is progressing. During the procedure, it was noted that the appearance of the tumor has changed since the last diagnostic procedure. The tumor has reduced in size at about 5.2 centimeter. However, the consistency and color of the tumor was of concern. The physician removed the tumor through the scope via laser with fulguration. Which of the following codes best describes this encounter? All right, coders, are you ready? Let's go ahead and code this one. I'll set your time for a minute and a half. And when you're ready, put your answers in the chat. Good luck. All right, coders, I believe that is time. Did you get your answers in? I want everybody's answers in this one. I think I have a good feeling that you got this. All right. Okay, so let's go ahead. So, as far as our keywords, we have 40-year-old, urinary frequency, blood, urine. We have 6.0 centimeter bladder tumor, diagnostic cystoutheroscopy. The tumor was reduced to 5.2, and the physician actually removed that tumor through the scope via a laser with fulguration. All right, coders, what did you come up for this one? Did you answer D? Well, if you did, great, great coding. Okay, and if you miss it, let's go ahead and go over this one again, okay? Shall we? So if you look at that code 52000, you will find that code in your answers B and C. And that is your code for the cystoutheroscopy, and this is a separate procedure. So remember that. Okay, I have everything else here too. So that separate procedure, remember the rule for a separate procedure, once it is part of a more extensive procedure, then that is going to be bundled into that surgical procedure. Okay, so what happened in our scenario? Yes, indeed, there was a diagnostic cystoutheroscopy happened during the encounter. But during this encounter, the physician also removed that tumor on the same scope via laser with fulguration. So now this cystoutheroscopy, the separate procedure, is going to be part of this, already an extent, a part or it's going to be basically going to be bundled into this procedure now. Because if you look, so I'm going to just go ahead and eliminate that answers for you, but I'm gonna prove that to you further as we go over the rest of the scenarios, okay? So look at that 52214 there for your answer A. That is your cystoutheroscopy, also with fulguration. What we needed, however, this one is focused on the trigone bladder neck, prostatic fossa, urethra, or periurethral glands. Back in our scenario, remember, we were actually dealing with a tumor, okay? So there was a tumor removed, okay? So that's not exactly what we're looking for. This is when they did that cystoutheroscopy with fulguration in the urethra and bladder. So we're going to go ahead and keep looking. 52240, this is from one family here of cystoutheroscopy with fulguration, including your cryosurgery or laser surgery. We like this because the laser is there. And resection of, as you can see, this is now talking about tumors. So you'll see that intended codes are talking about tumors based on the size. So we did have a 5.2 centimeter tumor that we need to code, and that small is up to 0.5 to 2 centimeters. The medium is 2.0 to 5 centimeters. And since our tumor is 5.2, so then we're going to have to code it at 52240. Okay, so that is all you need. Again, you do not need to code a separate procedure anymore because you already have a 52240 that already includes the sisters uteroscope, the fulguration, and it talks about the size of the tumor. Okay, so your answer is 52240. All right, and that's it. Hopefully you got this correct. If you have questions for me, I'm gonna be happy to answer them for you, and I know my co-instructors are gonna be standing by to help you out. So go ahead and ask those questions. In the meantime, we are actually gonna go ahead and move along, and we are going to talk about urodynamic studies. Okay, so are you guys ready? So, our urodynamic studies are used to diagnose patients who have urinary incontinence or other urinary symptoms. So, these tests are given to both men and women. This test is also used to measure nerve and muscle function, like so, and pressure. So, this one kind of constitutes the pressure and around in the bladder, the flow rates, and other factors. So this urodynamic test measures the amount of urine left in the bladder after the urination. So usually is they usually do this in an outpatient facility, sometimes can be in the inpatient too, and that's why we are going to talk about the guidelines here. So it's just pretty, short and straightforward. There are just two things that we need to also pay attention to when you're coding for the urodynamics. It talks about some modifiers here. So one is the modifier for multiple procedures, which is modifier 51. So the guidelines tells us that when a multiple procedure are performed in the same investigative session, we use modifier 51. Okay, that's one thing. Another modifier that involves here is that modifier 26. So mostly or normally all procedures in this section imply that these services are performed by or are under the direct supervision of a physician or other qualified healthcare professionals. And those are the things that's included in that procedure. Okay. However, when the physician or the individual only interprets the results and or operates equipment, or basically if you are only coding for the professional component of this test, then you would be using the modifier 26 to indicate that. Okay, and that is all in your CPT page 369. And that's it. So what do you say? Let's go ahead and get to some coding. I have another scenario for you guys. So let me give you the answers first. We have A, 51729, B, 51725, C, 51727, and D, 51728. A 43-year-old female recreational jogger recently noticed a urinary dribbling while running. The urologist recommended that the patient undergo a complex voiding cystometrogram. After the patient was prepped and draped, a transurethral catheter is inserted into the bladder. The physician will use a manometer to measure the pressure of the bladder and the urethra. The bladder is filled with water as the physician monitors bladder and rectal pressure. No bladder spasms were noted. Next, a urethral pressure study is carried out. Filling up the bladder again, the bladder pressure is measured. Withdrawing the catheter from the bladder into the urethra, the patient is asked to cough to record any urinary leakage. No leakage was noted. And finally, a voiding pressure study is carried out, and once again, the bladder is filled. The patient is asked to try to void, and the voiding pressure is documented. The patient's study was determined to be normal. Which of the following codes best describes this encounter? All right, coders, I think you know the drill now. I'm going to set the time for a minute and a half, and then get your answers in. Good luck. All right, that is time, coders. Ding, ding, ding. Get your answers in. Okay, so while you do that, let me go over our keywords here. We have a 43-year-old female, urinary dribbling, complex voiding cystometrogram, transurethral catheter inserted into the bladder, physician, manometer. We have bladder and urethra, monitors bladder and rectal pressure, pressure study, bladder pressure measured, and that, oops, went too far, sorry. And if you answered A, wow, great job. That is great coding there. And how did we come up with the answer? Let's find out. So we have a few answer choices here, and we definitely need our forensic reading here because we do have to usually when they're close, close together codes, you do have to see, what distinguish one code from another. So this is another channing tip for you guys too if you are watching out and looking for Chan. So look at that code 51725. Okay, we know we're coding for a uh, cystometrogram, okay, CMG. But if you look at 51725, again, this code is coding for a simple, okay? Back in our scenario, it was mentioned that it was a complex voiding cystometrogram. So see that if you highlighted this, underline this is the difference between that code and this family code here. So 51725 on your answer B is going to be out, okay? We're looking at this family here for a complex cystometrogram. However, we have to determine which of this is the correct answer. Okay, 51726 is complex cystometrogram, but did it include urethral pressure profile studies? There was a urethral pressure study there, but it was actually for a profile study. And this one is with urethral pressure study, urethral closure pressure profile, and that did not happen. Okay, didn't say anything about a closure pressure profile. So 51727 is wrong. 51728 also the same complex cystometrogram, but this is for voiding pressure studies with bladder voiding pressure. Didn't say anything about voiding pressure as well, so we can eliminate that too. I wonder where my on clicks are, but it's gonna get caught up with me soon. Now look at that 51729. That's a complex cystometrogram with voiding pressure studies. We know that happened there. Okay, the bladder, there goes my on clicks there, eliminating 51728 and 51727 both. Now look at that, drawing back your attention here. Sorry about that. 51729, again, complex cystometrogram with voiding pressure studies. Now, this is for bladder voiding pressure and urethral pressure profile. And that was exactly what was mentioned in our scenario. Okay, so because of that, we're going to choose A. That is the best answer out of the four. And definitely your forensic reading helped you out on this. I hope you will agree with me. So, do you have any questions? Go ahead and type them in the chat. What do you say? We'll do one more scenario under this section. You ready? Okay, I have one more here, so let's try this out. So we have A 50020, B 59405, C 50020, and 75989 with modifier 26, and for D 49405 and 75989 with modifier 26. Your scenario here is a 40-year-old banker with a short history of a persistent dysuria and right flank pain was recently diagnosed with a renal corticomedullary cyst of the right kidney. He arrives at the OR suite for a percutaneous drainage of the renal cyst. After the patient is prepped, draped, and anesthetized appropriately, the physician locates the area of the right kidney where the fluid collection persists. Percutaneous placement of a catheter is performed during imaging guidance to allow drainage of the cyst. After the physician is confident of the complete drainage, the catheter is removed and the small opening is stitched. Which of the codes best describes this encounter? Okay, I'll give you a minute and a half, and your time starts now, coders. Alrighty, as you can see, that is time. So I hope you got your answers in the chat by now. And let's go ahead and take a look at this one. The answer is B. So great job for those of you who got this correct. So we have a 40-year-old as our keywords: renal cortomedullary cyst, right kidney, percutaneous drainage. Okay, that's the what. Renal cyst, right kidney, those are your locations, percutaneous placement of the catheter. We have imaging guidance. Okay, that's probably why we see those imaging codes there, and drainage of the cyst. All right. Okay, so let's go ahead and take a look at this code descriptions here. So let's start with that 49405. So we know we're coding for the percutaneous drainage of the cyst, and it does involve a percutaneous placement of catheter under imaging guidance. So if you look at that code description, uh, 49405, image guided fluid collection drainage by catheter. I like this. Most of this actually matches our scenario. Okay, so I'm gonna hold on to this one. Hence, you have that star there. I like this so far. Like I said, it really matches our scenario, and this is for percutaneous as well. Okay, now let's go ahead and take a look at the rest of them just to make sure we're not missing anything out. So 50200 is coding for a renal biopsy for percutaneous right through car or needle. Nowhere does it say in this scenario it's talking about a biopsy whatsoever. So I know that that A there is out. Okay. Also, that 50020 and 575980 is also going to be out. Actually, I'm actually going to drive your attention here to that 75989 codes. That is coding for a radiological guidance, fluoro, ultrasound, or computed tomography for percutaneous drainage. Do we need these codes? Or do we need these coders? Let's take a look. And that parenthetical guideline, that's why it's always a good idea to read them, never, you know, oversee them or never take them for granted. Because if you read here, it tells us to do not report 75989 along with your code 49405. Okay, so that actually, you know, seals the deal there. We can code them together, so that would eliminate C and D. And of course, that is coding for radiological guidance. It makes sense to not, it doesn't make sense to code this. We have a code for that imaging guidance for a fluid collection, and that would be your 49405. So yes, your answer is B. So great job on this one, coders. I have a feeling that you rocked this scenario. So woohoo, great, great. All right. I think it's enough about me on this topic at this point. I think we're going to head on to a very interesting topic again. So let me see. Oh, I think it's back to you, Mrs. J.
It is. Thank you. Such a great job. Didn't she do a fantastic job, coders? Yes, I learned something. I did. I always learn something. All
Thank
right,
you, Mrs.
coders.
J.
You are welcome. Great job again. All right, so if you can just hand me the screen. Yes, they know I'm not as savvy as my counterparts here. All right, so here we go. We're going to resume the discussion. Now we're going to move on to the reproductive system, specifically the male reproductive system. All right, so we know that males pretty much their reproductive system is pretty standard. I mean, you can kind of see their organs. We know the penis, and now we know the urethra. This is the hole that the urine and sperm comes through. Yes. But additionally, let's talk about the testicles. Most men have two. For whatever reason, some people are born with just one or they lose them. Accidents can happen and they can have, to have to get one removed. But that's a different story. However, these testicles have two very important functions. They produce sperm and they secrete the hormone testosterone. That's really important to the male reproductive system. Now, the epididymis, this tube right here, The epididymis is important too, because this is what helps to carry the sperm from the testes to the vas deferens. See this vas deferens? So the epididymis helps to transport sperm to the vas deferens, and then the vas deferens, what do? They go through the urethra. But look where it goes. See, it goes right in here. And what is that? Well, that's the prostate gland. Yes, the prostate is humongous. It's very, very important in the male reproductive system because their main purpose is not only to secrete prostate fluid, and that's one of the components of semen. However, the muscles within this prostate organ, they help propel that seminal fluid into the urethra during ejaculation. So that's important as well. So I'm going to get off my um, horse, my AMP horse, and we're going to move on and we're going to talk about some key procedures. Circumcisions. When you are coding circumcisions, it's important that you understand the following guidelines. But for those of you that don't know, circumcision is pretty much the removal of foreskin. And you can see right here on the right, this is an infant penis. The left is an uncircumcised penis and the right is circumcised. And they pretty much remove the foreskin, and that's called a circumcision. And yes, adults can have these circumcisions performed as well. And there are different types of procedures that they use. Right here, if you look right here, this appears to be a procedure that involves an excision. They're excising the skin. And then right here, this looks like a clamp procedure. So there are multiple types of procedure, and therefore there are multiple guidelines that you need to pay attention to. Now, when coding for circumcision, it is very, very important that you be forensic. All right. So the guidelines are as follows. Maybe I'll talk about the guidelines when we get, how can I say it? I'm not going to tell you the guidelines. I'll tell you the guidelines after we do the scenario because it will make more sense when we do that. All right, so pretty much the guideline is read very carefully when you're coding circumcisions. And also, there are blocks. You know, this is how they anesthetize the patient. They can use a regional or dorsal nerve block. And you know what? I used to work in urology, and I worked in pediatric urology, and they performed circumcisions in the office. Yes, and there was no there was no anesthesia, and that was the hardest part of the job. You know, especially if a brit was being carried out. That's a Jewish ritualistic procedure. Sometimes, you know, when babies have abnormalities, you know, penile deformities and abnormalities, they can't have a standard circumcision or a brit. They can't have the normal one, so they'll have a brit. The pediatric urologist will help carry out the brit. So that was kind of tough. But anyway, I digressed. But now let's go ahead and let's solve this scenario, and let's also learn the guidelines at the same time. All right? Maybe the next scenario we'll really learn guidelines, but let's move on. A 14040 541606351 modifiers. 541646351 modifier. B 54160 5416451 modifier. 1404051 modifier. C 14040 5416051 modifier, and D 5416051 modifier 54164. Brady, a 28-day-old infant with a body weight under 4 grams had a frenulotomy and circumcision performed. This required an adjacent tissue transfer repair measuring 2 square centimeters. What CPT codes is or are reported? All right, coders, I'm going to give you a minute and a half. Time's up. All right, coders, I'm not going to reveal the answer until the next screen. Brady, a 28-day-old is our keyword. 4 grams, frenulotomy, circumcision, ATT, 2 square centimeters. All right, so what happened? Well, we had a frenulotomy, we had a circumcision, and we had an ATT. All right. So, one second. I want to just get my bearings. All right, so we know that we have to code for an ATT, a frenulotomy, and a circumcision. Now, this doesn't have to be in, in any particular order. Just, we just know that we have to code for it, okay? All right, so let's go. All right, we've got our 3 procedures. And just so you know, a frenulotomy is a piece of tissue that's stuck together. Like if you have a tongue, underneath your tongue, that little piece of tissue. On some males' penis, they have that tissue at the dorsal part of the penis, and that is a frenulotomy. All right, so that kind of just takes me into this. That's going to be the basis of a lot of things right now. It's going to make sense in a minute. So it's really not a significant procedure, and you're going to see something in a minute. All right, so we know that 54160 is a circumcision. That's the code for circumcision. And this, let's read it. Circumcision, surgical excision other than clamp, device, or dorsal slit. Neonate, 28 days of age or less. Hey, that sounds like that's what happened. Yeah. All right. And if you look at frenulotomy 54160, this is the code for frenulotomy of penis, but it's coming up wrong. And the reason why is if you look at this parenthetical guideline, it tells you do not report 54164 with circumcision codes 54150, 6.1, 6.2, and 6.3. So you do not code frenulotomies with circumcisions, because when you carry out a circumcision, you're removing that piece of tissue. So that's redundant. So A has 54164, it's coding for it, and so therefore B is coding for it, and so is D. All three are wrong. So that's why knowing what a frenulotomy is important. And you know what? C is correct. The first code is for the ATT. The second is for the circumcision. They need to repair the incision. So they use the ATT. All right, coders, did you get that correct? Outstanding. If you learned something, that's priceless. All right, coders, I got another scenario for you. A, 54150. B, 54150 with a 52 modifier. C, 54160, 54161. A 6-month-old infant who had complications during the birth process, which prohibited him from having a circumcision shortly after delivery, arrives to the OR today for a circumcision. A caudal block was administered for anesthesia. The foreskin was clamped and removed. The infant tolerated the procedure well. Which of the codes best describe this encounter? Okay, coders, I'm going to give you a minute and a half. All right, coders, how did you do? All right, so this is going to be our scenario where we're going to review the guidelines, and pretty much the guidelines are to read forensically. Okay, here is the answer. If you said, oh, well, no, we're going to review the keywords and then I'm going to show you the answer. 6-month-old, OR today, circumcision, caudal block, administered for anesthesia, foreskin clamped, removed, and the answer is B. Yes, B. Now let's see how we arrived at this. Well, the first thing that we did is we noted 54150. This is the code for circumcision using clamp or other device with regional dorsal penile or ring block. All right, so this means that they used the clamp and they provided a ring block. And 54160, this is a circumcision, surgical excision of other than clamp device or dorsal slit. And this baby has to be 28 days of age or less. So that's wrong. And so is 54160, because again, this is a surgical excision other than clamp. didn't we have a clamp? Yeah, so we have to code the clamp. So we're going to get rid of 54160 and 54161. Gotta go. And that leaves us with 54150. This is the code for circumcision using clamp or other device with regional dorsal penile or ring block. And that's where I have an issue. No regional or dorsal penile ring block was done. This patient had a caudal block. So this code is not correct. But we do have some parenthetical guidelines that really guide us. And if you look at this second parenthetical guideline, it says report 54150 with modifier 52 when performed without dorsal penile or ring block. Boom. So we are going to append a modifier 52, and we're coding for our caudal block, and therefore B is our answer. All right, coders. So the guidelines for coding a um, okay, I really don't know how to say these guidelines, but let me try and do it. The guidelines when coding for circumcisions, you can use code 54150. This is the code for neonates. Now make sure you use modifier 52 without dorsal penile nerve or ring blocks. So you got to be very specific. And I think I gave you a image earlier so you can watch the playback of the dorsal nerve blocks. And remember, blocks are anesthesia. And I think that's it. So you just got to watch that modifier 52 and just pay attention to what you're coding for. And these codes right here are surgical excision. So they're actually cutting. This code 54150, they're using a clamp to cut. All right, so earlier too, I showed you an example of an excision of the skin, and I also showed you an image of a clamping of the skin. All right, so I think this is where I turn it over. And this is going to be a fabulous presentation on the female reproductive system. Mrs. Tracy, go ahead and take it away.
Okay, thank you so much, Mrs. J. Wow, that was a great presentation on the male reproductive system. So yes, we are turning our attention now to the ladies. So we're going to talk about the female reproductive system. Okay, this is always a fun section to cover. The female reproductive, so here's a little bit of anatomy as you can see in front of you. There's your female reproductive system, and this system includes the ovaries, the fallopian tubes, uterus, vagina, accessory glands such as your mammary glands, and the external genital organs. And just to get you more familiar with some of the most common parts of your reproductive system, the uterus, that is the central organ of the reproductive system. If you see this little narrow area right here, you see the uterus and it kind of tapers down right there. That is the referred to as the cervix uteri, and that is the neck of the uterus. So that's the lower part of the uterus, and it tapers down to connect to the vagina. And the cervix, or the opening of the cervix, is referred to as either the cervix OS, or you'll hear it referred to as the external OS. The corpus uteri is just simply the body of the uterus. And then you have your fallopian tubes on either side right here. Those are bilateral. And your fallopian tubes, those are the tubes, they transport the egg from the ovaries, as you see right here. They transport the egg from the ovaries into the uterus or the womb. And the ovaries is where the egg is produced, or sometimes you'll hear it referred to as the ovum. And when that's released, again, those will travel, as you can see right here, they'll travel up into the fallopian tubes, and it'll go down into the uterus where it can become fertilized by sperm. Okay, and again, both of those are bilateral, and you'll hear these ovaries and fallopian tubes referred to as by their medical terms. So you'll see salpingo is the fallopian tube, and you'll hear the oophorectomies and stuff. Those would be the ovaries. Okay, it's the removal of the ovaries. All right, and I think that's it. So we're going to go ahead and talk about hysterectomies. And the hysterectomy is just the surgical removal of the uterus. It may also involve removal of the cervix, the ovaries, fallopian tubes, and some of the other surrounding structures. This is usually performed by a gynecologist, and they may be, the hysterectomies can be either total or partial, and it is the most commonly performed gynecological surgical procedure. So let's talk a little bit more in depth about the total and the partial hysterectomy. So here's a nice image for you to see. Your total hysterectomy with removal of ovaries and fallopian tubes would be right here in the left image. Okay, so that's basically everything's being removed, including the ovaries and the fallopian tubes. Now go over here to your partial hysterectomy, and the partial hysterectomy is just basically the removal of just the uterus. Okay, and the cervix is left intact, as you see right there, okay? And then the total would be the removal of the uterus and the cervix. And again, like I said, pay attention to if the ovaries and fallopian tubes are being removed, okay? So in the image on the left, everything's being taken out, including the fallopian tubes and the ovaries, okay? And then in the images on the right, you either have your partial or your total, and those are both without the removal of the ovaries and fallopian tubes. So it's really just important to know your guidelines when it comes to that, okay? All right, so again, know the type of procedure that you're dealing with. What anatomy? So is it uterus? Is it the cervix? Is it mentioning surrounding structures? Is the ovaries and the tubes being removed? And another thing really important to watch out for on these procedures, whether they're open or they're laparoscopic. Okay, so pay attention to that documentation. All righty, and with that being said, are you ready? Here's a scenario for you. We have A 58950, B 58575, C 58951, or D 58952. A 52-year-old female university student life administrator diagnosed with a malignant uterine tumor arrives at the OR to undergo a total hysterectomy. After the patient was placed in dorsal lithotomy position, she was prepped, draped, and placed under general anesthesia. The abdominal cavity was entered through the navel using a Veress needle, and the laparoscope was inserted. The laparoscope was inserted. The abdomen was inflated with carbon dioxide gas for better visualization. The patient was then placed in Trendelenburg position. Small incisions are made around the abdomen for surgical tools and trocars. A robot is docked to the laparoscope. A colpotomizer device is inserted into the uterus through the cervix, and the tumor situated on the uterine wall was noted, and uterus is dissected. The ureters are identified and dissected free to enable the remaining procedures to be carried out. A heated instrument is used to dry up the infundibulopelvic ligaments, allowing the complete detachment and removal of the folds of peritoneum, omentum, uterus, cervix, ovaries, and fallopian tubes. After all of the organs are removed, a sponge is placed into the vaginal cuff area and the abdominal cavity is reinflated. The vaginal cuff is sutured through the laparoscope. After confirming there is no bleeding, the abdomen is deflated and all laparoscopic instruments are removed. The incisions are closed in layered fashion. Which of the codes best describe this procedure? All right, coders, got a minute and a half. You got this. Good luck. Sorry about that. Not sure what happened there. Okay, your time begins now. All right, get your answers in the chat. How'd you do? I have a feeling some of you may have got this pretty quickly. Just remember, follow those keywords. I know this looks like a huge scenario. You know, there's a lot of words here. However, we're just going to follow exactly what happened here. And you'll see what I'm talking about in just a moment if you haven't already discovered it. But looking at my answers there, it looks like all of them, all the codes are pretty close together. So I'm going to go ahead and reveal the answer. And our answer is B. Okay, let's find out why. My keywords, I have 52-year-old female, malignant uterine tumor, total hysterectomy, it's a major keyword, placed, dorsal lithotomy position, laparoscope, very important word as well, insert it, abdomen, abdomen again, insert it, uterus, cervix, tumor, uterine wall, uterus is dissected, ureters dissected free, heated instrument, complete detachment, removal of the fold of peritoneum, omentum, uterus, cervix, ovaries, fallopian tubes. All other organs are removed. So everything's being removed here via a laparoscopic procedure, okay? So that is our key right there. Okay, that's the main thing I see here, that we need to know whether this is open or laparoscopic, and that's going to really direct us, guide us in the right direction on how to code this. So if we look at A 58950, okay, that is going to be incorrect. And why is this? This says it's for a resection of ovarian, tubal, or primary peritoneal malignancy with bilateral salpingo oophorectomy. Remember, that's the removal of the fallopian tubes and the ovaries on both sides, and the omentectomy, okay? I'm seeing a lot of keywords here. However, the way that this procedure was performed was not an open approach. And this 58950 family right here is for an open approach, okay? And we have to code for laparoscopic. Okay, so if you just put this next to that code, just to let yourself know, hey, this is for open. Anytime you see laparoscopic, that is through a scope. That is not an open procedure. Okay, so that's going to basically narrow me down here. So if I look at 58950 and the rest of this family here, we have 58951, that's in C, and 58952, that's in D, okay? That's all part of the same family. That is an open approach, okay? That didn't happen. So I know right now I can get rid of all of those codes. Boom, 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 just like that, okay? So it narrows it down to B, which is 58575, and there is our key that we're looking for. That is for a laparoscopic approach. Total hysterectomy, that was also performed here. Resection of malignancy. Okay, it says that the patient had a malignant uterine tumor with omentectomy, including salpingo oophorectomy, unilateral or bilateral. So it doesn't matter if it's one side or both sides when performed. Okay, so that is going to be our answer B. And it basically all came down to the way that was approached. Okay, was it an open approach or was it laparoscopic? It was laparoscopic. Okay. So that's our final answer. So let us know in the chat if you got that. If you didn't get it, but you understand now, also let us know that, please. And with that being said, let's move on to our next subject, okay? We're going to talk about deliveries, and I just love this picture. Let's give credit to Miss Rochelle for finding this amazing picture. I just love it. I love it. I love looking at this one. So in this section, when you're coding for deliveries, there are 3 types of deliveries, either vaginal, C-section, or VBAC, okay? We'll be talking about VBAC soon. If you're like, what are you talking about, Miss Tracy? We'll be talking about that. However, if you know what a VBAC is, go ahead and type it in the chat for me, okay? Type it in the chat, and we'll be revealing that shortly. Okay, so first of all, let's go ahead and talk about some guidelines. You'll find these guidelines in your 2019 manual on page 401, okay? And so some things to remember here, for maternity care and delivery, the services normally provided in uncomplicated maternity cases include, so these are bundled, the antepartum care, the delivery, and the postpartum care. So if doctor performs all three of those, there is going to be a package code. You're just going to be coding one. So if he's providing the antepartum, the delivery, and the postpartum, there's one code. We'll talk about that soon. Okay, it goes on to say pregnancy confirmation during a problem-oriented or preventative medicine is not considered part of the antepartum care, and you would report these E&M services, okay, for that visit if that took place. And then this next paragraph talks about antepartum care and what that consists of. Anything outside of what they define as the antepartum care can be coded separately, okay, or should be coded separately. When reporting delivery only, so if that surgeon is only, or that doctor is only delivering the baby, then there's a set of codes. Okay, you have 59409, 59514, 59612, and 59620. Okay, and then the post-delivery management and discharge services would be used with your E&M codes. Okay, and then actually, I think my on-clicks are out of order. There we go. If there's any medical complications of pregnancy, such as cardiac problems, neurological problems, diabetes, hypertension, toxemia, there's a whole bunch listed there. They may be reported separately, okay? And if all or part of the antepartum or postpartum patient care is provided except delivery due to the termination of pregnancy by abortion or referral to another physician or other qualified healthcare professional for delivery, you want to see the antepartum and postpartum care codes 59425, 59426, and 59430, okay? All right, so let's go ahead and talk about this. So our total maternity package, they have, remember I said there's one code. So if the physician performs the postpartum, the prenatal care or the antepartum care, it's also referred to as that. He also does the delivery and he provides the postpartum care after the delivery. He would report one code, okay? And there's a package code for a vaginal delivery and a C-section delivery. So if you know the vaginal delivery code, go ahead and type it in the chat for that package. But again, these are all bundled into one code, and that code is going to be 59400. 59400, okay, and you'll find that located on page 403. So you might just want to notate next to that code that that is the total package for a vaginal delivery, okay? Now, if you have a cesarean delivery, it's the same thing, but it's a different code, okay? That would include the prenatal, the cesarean delivery, as well as the postpartum care. So if the doctor provides all three of those services, your code for that is going to be 59510, okay? All right. So let's go ahead and talk about VBAC. So what'd you guys say about this? Our VBAC stands for vaginal birth after a cesarean. Okay, so sometimes a patient that had a prior cesarean delivery might want to try with their next child to deliver vaginally. Okay, so in that case, that would be referred to as a VBAC. And these VBACs, they are classified in two ways. They're either going to be successful or unsuccessful. So there's certain codes for that. And there's also just as, hold on, let me go ahead. Let's go ahead and talk about these guidelines real quick. Okay, so patients who have had a previous cesarean delivery and now present with the expectation of a vaginal delivery are coded using this code range, 59610 to 59622. And just like our vaginal and our C-section packages, these VBACs also have packages as well. And those are whether they are successful or unsuccessful, there's a package for each one. So a successful vaginal delivery, of course, would mean that it was successful. And then you would use codes 59610 to 59614. And if it is, if it's successful and the physician does the antepartum, the delivery, as well as the postpartum care, the package is 59610. Okay, if you have to break it up for any reason, you would use the rest of those codes in that that you see in that code range. Okay, if it is unsuccessful, meaning that they tried but it just didn't happen, so they had to revert back to a C-section, then you would use code range 59618 to 59612. The 59618 is going to be your package code. Okay, so you might want to write next to 59618, total package for unsuccessful VBAC, and next to that 59610, total package for successful VBAC. Okay, it's really important to notate this section correctly because you could very well get tested on this on your exam. Okay, or if you've already taken your exam, you know that this is a possibility. So it's really important to know how to code these. Okay, and then to report elective C-sections. Okay, so if a patient, just says, hey, I don't want to try, I already had one C-section, I just want to go back and do another C-section, they're electing to do that, just go to do a C-section, then you would use code 59510, 59514, 59515, okay? So, and again, that 59510 would be your total package for C-section. All right. And there's your package again, okay? And again, like I said, just remember, just pay attention to whether it's successful or unsuccessful, okay? All right. So I have a scenario for you. Are you ready? Ready? All right, here's your answers. A, 59820, 99215, modifier 25. B, 59820. C, 59812, 99215, modifier 25. Or D, 99215. A 23-year-old mother of one, G2P1, presents to her OBGYN's office at 9 weeks pregnant because she noticed some vaginal bleeding. The physician performs a comprehensive history and exam and determines the patient has endured a spontaneous abortion. The physician advised the patient to take it easy over the next few days and no further intervention was necessary because no fetal contents remained and the patient completely aborted the fetus on her own. What is or are the correct procedure codes for this encounter? And I will give you a minute and a half and your time begins now. Good luck, everyone. Okay, time is up. Go ahead and put those answers in the chat. And let's go for it. Let's go ahead and see what our keywords are. We have 23-year-olds, mother of one, G2P1. that means 2 pregnancies, so it's Gravida 2, and then P1 would mean how many live births, so 2 pregnancies, 1 live birth, presents to her OBGYN's office at 9 weeks pregnant because she noted, sorry, I don't know why I'm reading it. I'm getting off track. Okay, here's our keywords. 23-year-old G2P1, 9 weeks pregnant, vaginal bleeding, comprehensive history exam, spontaneous abortion. Patient completely aborted the fetus on her own. Okay, that's really important to note. And let's go ahead and see the answer is going to be D. Simply going to be that E&M office visit, okay, 99215. So let's go ahead and see why. Okay, so this 59820 and 59812, those are abortion codes, and then we have our office visit codes at 99215. Okay, so let's go ahead and look at 59812. This is treatment of incomplete abortion any trimester. The keyword here that I see is this was completed surgically. Okay, meaning that the doctor is performing this abortion, okay? And if we look at our scenario and our keyword, it said this is a spontaneous abortion, okay? It doesn't say that the doctor intervened in any way, okay? This patient completely aborted the fetus on her own. Okay, so this would definitely not be an incomplete abortion, and it also is not going to be a missed abortion because that one, as you see as well, is also completed surgically. Okay, so those are both completed surgically, meaning the doctor aborted. Okay, so we can go ahead and we can get rid of. Oh, and then I'm just highlighting my keywords over on the side. So again, this is a spontaneous abortion, and the patient completely aborted the fetus on her own. And if you look up at our parenthetical guideline up at the top, under where it says abortion, it says for medical treatment of spontaneous complete abortion any trimester, we're going to use the E&M codes, okay? And then for a surgical treatment of a spontaneous abortion, meaning that you know, the doctor had to intervene in some way and remove some of those contents, then you could use that 59812. But in this case, the doctor didn't have to intervene in any way surgically. And it says in the documentation that that fetus was completely aborted on its own. Okay. So basically a miscarriage. Okay, so we can go ahead and get rid of A, B, and C, and D. That would make D our correct answer. Okay. Alrighty, so go ahead and type in the chat. Let us know how you did. And I'm going to show you a little something that might help you, okay, for the types of abortion. So a spontaneous abortion is basically a miscarriage, and that occurs without any intervention or drugs or instrumentation, okay, as we saw in the last scenario. Legally induced abortions, that's an elective abortion by the patient, and that is induced by a medical professional or for therapeutic or elective reasons. Illegal induced abortion, this is an abortion that's not performed by a qualified healthcare professional. And a failed abortion is when an elective abortion is not successful and the patient is still pregnant. Okay, so they attempted an abortion, but it wasn't successful. The missed abortion is a fetal death before the completion of 20 weeks gestation. An incomplete abortion is a miscarriage in which some fetal or placental tissue remains in the uterus. And in that case, when you have an incomplete abortion and the doctor has to go in there, then that's when you would use that 59812 as it's stated in the parenthetical guidelines, okay? So in our last scenario, we were dealing with a spontaneous abortion and there was no surgical surgery that was required after that miscarriage, okay? Alrighty, so let's go ahead. I have another scenario for you. We have A, 59400, B, 59426, modifier 56, 59430, 59 modifier, modifier 55, C, 59430, D, 59400, modifier 54, 59425, modifier 56, modifier 59, 59430, modifier 59, modifier 55. Melanie, a 29-year-old domestic engineer who lives in Kansas City, is 38 weeks pregnant, visiting family for the Thanksgiving holiday in upstate New York. During dinner, Melanie went into labor and was rushed to the local hospital. The obstetrician on staff contacted Melanie's private OB, Dr. Trent, who administered all of her prenatal care every every month throughout her 9 months of pregnancy to obtain a complete history of the patient. Dr. Trent reported that all of the patient's visits were straightforward exams with low medical decision making. After speaking to Dr. Trent, the hospital's OB delivered a healthy 8-pound baby boy vaginally without complications. Melanie returned home and Dr. Trent provided her follow-up care. Code for Dr. Trent's services. All right, coders, good luck, and you have a minute and a half. Okay, get those answers in. Okay, so let's go ahead and look at this. Looking at my answers, I see that A and D share the same first listed code. And if we recognize that, we already talked about that 59400. So remember what that one was? That was our total package code. All right, and then I also see some modifiers here that I'm interested in. Okay, so let's go for our keywords. We have 29-year-old lives Kansas City. She's 38 weeks pregnant. She's visiting in upstate New York. She went into labor while she's there, and she's taken to the local hospital. The obstetrician contacted her regular OB, Dr. Trent, who administered all of the prenatal care. The hospital OB delivered the baby vaginally without complications, and Melanie went home, and her regular doctor, Dr. Trent, provided her follow-up care for her. Okay, and who are we coding for? It's really important to know who we're coding for. It says we're coding for Dr. Trent. Okay, so our answer is going to be B. Okay, and let's find out why. Okay, so if we know and we can recognize this 59400, even if you're not sure what that is, if you have it documented here that this is for the total package, remember total package includes your antepartum, your delivery, and your postpartum, then you would know whether we can, right off the bat, whether we'd be able to code that or not, because our documentation tells us that we're coding for Dr. Trent, and what did Dr. Trent provide? Okay, let's go ahead and look. He provided her prenatal care, and he also provided the follow-up care. However, he would have delivered her baby, however, she was out of town, or she was out of state, right? So she was out of state, so she had to be rushed to the hospital there in New York, and that surgeon had to deliver her baby, okay? So that means that Dr. Trent cannot code this total package vaginal delivery, because in order to code that, he would have to perform all three of those services, and he didn't, okay, because of these circumstances. So in that case, we cannot code total package. So we're going to go ahead and get rid of A, and we're going to get rid of D, okay? So again, going back to just coding for Dr. Trent, we're not coding for that. It's not asking us to code for the OB doctor. So we're just coding for her doctor, Dr. Trent. Okay, so we're going to code the pre-op and we're going to code the post-op, okay, or the postpartum care. Okay, so postpartum care is 59430. Okay, and notice that says separate procedure. And we can code that separately because it's distinctly different than the antepartum care, which is going to be at 49426. We just have to make sure that we append that modifier 59, okay? So the antepartum care, since he provided all of her all of her prenatal care, it would be 7 or more visits, okay? So that would be 59426. And so we can go ahead and get rid of C. And you see that we have these modifiers. So we have modifier 56 and modifier 55, okay? That modifier 56 is appended to 49426 to just indicate the preoperative care, and the modifier 55 is placed there to indicate the postoperative care, okay? And so B is going to be the correct answer. All righty. So what do you think? Go ahead and type it in the chat. Does that make a little bit more sense to you when we're talking about the total package? I think just putting it in a scenario actually kind of ties it all together. So hopefully that does, and hopefully you will notate these total package codes. It's very, very beneficial if you do, okay? Okay, and you might just want to, box where you have your antepartum and your postpartum or something that's going to help it to stand out for you. Okay, so I'm going to move on, and I have another topic of discussion, and that's going to be thyroids, okay? And our thyroid gland, as you can see here, this is a large thyroid here on this patient. But the thyroid gland is a butterfly-shaped organ, and it's located at the base of our neck. It releases hormones that help to control metabolism, okay? And that's the way that our body uses energy. The thyroid's hormone regulates vital body functions that include things such as how fast our heart beats, how deep we breathe, and also controls whether or not we gain or lose weight. It also helps control the body temperature, our cholesterol levels, and also women's menstrual cycles. Okay, so let's talk about thyroidectomies. And the thyroidectomy is just simply a surgical procedure that removes either all or part of the thyroid gland. And it's used to treat diseases of the thyroid gland, also that includes thyroid cancer. Okay. And as you can see in this image, it shows you how the procedure is performed for a thyroidectomy. Okay. All right. And then here's some other images. I like this image right here. It shows you normal thyroid, thyroid that has some inflammation, a goiter, and a thyroid that has cancer. So when a thyroid's normal size, it can't be felt. As you saw in that first image, you can kind of see that that was bulging out on the neck. When the thyroid's normal, you won't be able to feel it. Okay, and the thyroid levels are measured by TSH levels, and the normal range is 0.4 to 4.0 milli international units per liter. When you also see this term goiter, and a goiter is basically used as a term for thyroid swelling, and they can be harmless, or they can represent an iodine deficiency or a condition that's associated with thyroid inflammation that's called Hashimoto's thyroiditis. Okay, and let's see, the cancer, if you see the last one right there, that's an uncommon, thyroid cancer is not very common, I don't think, but it is usually curable. So some of the ways that they can treat it is by surgery. So that would be the removal of the gland. They can also use radiation, and hormone treatments may also be used to treat the thyroid cancer. Okay. All right, and this image is just kind of showing, you know, if part of that thyroid is removed. So actually, I want to show you something real quick. Okay, I want to show you this. I like using this little image down here, and we'll see this again. In a scenario that I have for you. But just real quick, your thyroid contains a right lobe and a left lobe. And again, this is the patient's right and left. And the little thing in the middle, that is called the isthmus. Okay, so as you see in this first image here, that is a lobectomy. Okay, so I know sometimes, and including myself, I have got this confused in the past, but when it says a total thyroid lobectomy, it means just one part. It doesn't mean the total thyroid's being removed. It means that just the total thyroid lobe is being removed, okay? So as you see over here, we like to use these bow ties as representations for the thyroid because we do have a right, left, and the thing in the middle is the isthmus, so it kind of looks like a bow tie. But say that you're just having your, as in that image right there, just the left thyroid is being removed. That's a total thyroid lobectomy, okay? The subtitle thyroidectomy that you see in the middle, that is most of the one in white, that is what's being removed, okay? So it's most of the thyroid. It's all of one lobe and most of the other part, okay? But there's still a little bit that's left. And then the last image, that's everything. That's your total. So the first one's a total thyroid lobectomy. This last one is a total thyroidectomy. Okay, so that's everything's being removed. So that whole bow tie, that would mean everything's gone there. Okay, and when you're coding these, sometimes, a lot of times the isthmus doesn't matter whether it's being removed or not. It will say with or without isthmusectomy, a lot of those codes. So just pay attention to that code language. And also you'll see contralateral. Contralateral, contralateral just means that it's the opposite side, okay? So it might say total thyroid lobectomy with contralateral subtotal lobectomy. That just means one full side and most of the other side, okay? So contralateral means opposite side, okay? And I have a scenario for you. So here's our answers. We have A, 60220, B, 60225, C, 60210, or D, 60212. Mary, a 40-year-old healthcare administrator, was diagnosed with a thyroid tumor. She presents today to have half of her left thyroid, isthmus, and 3/4 of her right thyroid removed. Code for the surgery. All right, everyone, minute and a half, and your time begins now. Okay, time is up. I know, I have a feeling that you all rock this. So let's go for it. Our answer is D, okay? Answer is D. And our keywords here are 40-year-old, diagnosed thyroid tumor, half of her left thyroid, isthmus, and 3/4 of her right thyroid is removed, okay? All right, so um, we gave you a little sneak peek here of when we have our TTT manual, and our TTT manual has houses all of the guidelines. So it's really easy to follow. This helped me tremendously when I was studying for my CPC exam. And these are some of the things that you'll see. We have all the guidelines and they're just listed out for you like this. So just some things to ask yourself, some things to consider. And these are things that we tell you to place on your page too to help you along. So we want to know first, are we dealing with a total or partial? Is it a thyroidectomy or a lobectomy? Um, Total thyroid lobectomy includes 2 complete lobes and or the isthmus. Okay, we talked about that already. Your total thyroid lobectomy, unilateral, is 1 lobe. We also talked about that. Your partial lobectomy, so that's a piece of the lobe, is up to half of the lobe. Subtotal is almost total, and the contralateral, we talked about that, is the opposite side. Okay, the horizontal cut. Okay, so here we go. There's our thyroid representation again. And what it tells us in our scenario is that half of her left thyroid is removed, the isthmus is removed, and 3/4 of her right thyroid. Okay, so we're going to go ahead on our little diagram here, and we're going to mark that. So, I think I have those 2 backwards. I'm so sorry. I do. Yeah, I do have it backwards. Okay, just imagine those were flip-flopped. So, um, so we have half of her left thyroid and 3/4 of her right thyroid are removed. Okay, so not quite the whole thyroid, the whole lobe on each side. Okay, we have half on one side and 3/4 on the other side. Okay, and then the isthmus in the middle, that was also removed. Okay, so let's look at these codes. 60220 is for a total thyroid lobectomy unilateral. This code right here is for a total thyroid lobectomy. Okay, that would be a removal of 1 whole lobe. And if you look at our diagram here, we don't have any lobe that's completely removed. Okay, so we can't code 60220. And we also can't code 60225 because that's also part of the same family, meaning that one part of that thyroid lobe is removed. So that would be the total lobe. And I don't see a total lobe removed on either side here. Okay, so get rid of A and we can get rid of B. Okay, and there's just some little things for you to look at there. And notice here 60220 is unilateral with or without isthmusectomy. So it doesn't matter whether the isthmus was removed or not. Okay, it still would be the same code. 60210, that is for partial thyroid lobectomy, unilateral, with or without isthmusectomy. So that's just part of 1 lobe, okay, that was removed. And we have to code for the other side, okay? So that gives us part of what we need. However, it doesn't give us the full thing, okay? So we have to go down a little bit further so we can get rid of 60210 and answer C. We're going to go down to the next code in that family, and that says partial thyroid lobectomy on one side, so part of one side, with contralateral subtotal lobectomy. So it would mean most of the other side, okay, of the lobe, okay, and that includes the isthmus. All right, so that's the code that we're looking for because we had part of one side and most of the other side as well as the isthmus removed, okay? So D is going to be the correct answer. So hopefully those little drawings help you a little bit, okay? Just remember partial is a piece, total thyroid lobectomy is the full lobe, and then total thyroidectomy is everything, okay? And contralateral is opposite. All right, so hopefully that helps you to understand thyroids a little bit better. And go ahead, if you have any questions at all, type them in the chat to me, and I'll be there talking with you. And I'm going to hand this on over to Miss Rochelle. So whenever you're ready, Miss Rochelle.
Thank you, Miss Tracy. I know that bow tie really helped me tremendously. So it's actually genius. So go ahead if you are planning on, looking at our TTT manual for more of those information and our guidelines. Ask about it in our customer service. And Miss Tracy, can I just say you are just amazing. That was great, great discussion from female reproductive, deliveries, and thyroids. Wow. Isn't she great? Mrs. J said, you can close it all out, Miss Tracy, because you're rocking it. All right. Okay, coders, back to you. Back to you. Do you want to do a little bit of a coding challenge before we end up today's discussion? I bet you do. So let's go ahead. I have one good scenario here for you. So let me start with our answers first. We have A 57288, B 57288, 57267, for C 51992, and D 51992 and 57267. A 42-year-old mother of four with a history of urinary incontinence indicates she has a loss of urine after coughing or laughing. She is diagnosed with cystocele. She arrives today for a bladder sling with mesh procedure. The patient is prepped, draped, and anesthetized. A small incision is made just beneath the navel. A laparoscope is inserted through the incision. The surgeon is able to see the urethra and bladder. Another small incision is made on the side of the abdomen for the insertion of the surgical instruments. A catheter is placed into the bladder. A synthetic mesh sling is placed at the junction of the urethra and bladder and sutured to suspend the urethra to provide extra support and reduce leakage. Bleeding is controlled. The laparoscope and instruments are removed. The incisions are sutured in layered fashion. Which of the codes best describes this encounter? All right, coders, I know you're going to rock this one. So I'm going to start the timer and you can begin now. All right. Like I said, I really have a good feeling on this one. So I bet you got your answers down there in the chat. And let's see here. So we have our answer C. So as far as the keywords, we have history of urinary incontinence, cystosteel, bladder sling with mesh procedure, laparoscope, that's a big keyword there, small incision, side of the abdomen for the insertion of surgical instruments, synthetic mesh, sling, we have urethra and bladder and sutured, extra support reduced, laparoscope, and instruments removed. Okay. So basically, if you're being forensic and you follow your keywords on this one, then you would know what exactly you're coding for. So you have to identify, are we coding for a scope procedure or an open procedure? So that 57288 code there is coding for sling operation for stress incontinence. And this is actually coding for an open procedure. However, back in our scenario here, it was mentioned that a laparoscope was used. Okay. So if you read the parenthetical guidelines, it's telling us here for laparoscopic approach, which is what happened in our scenario, we have to use that code 51992. And just to go ahead and confirm that here, so that actually makes 57288 the wrong answer, right? Because that is coding for an open procedure. We are in our scenario coding for a laparoscope. So that eliminates A and B. So hopefully you're following along. And now let's take a look at that 51992. This is your laparoscopy surgical Okay. And with sling, or I would say laparoscopy surgical sling operation for stress incontinence. Perfect. That's exactly what we need. Example, fascia or synthetic. So that also is good. All our keywords are matching up here. But let's talk about that mesh, because some of these in your answer D is adding that 57267 add-on code there. So if you read that, that is for the insertion of mesh or other prosthesis. Okay. But this is for a vaginal approach. Okay, this is now what happened, because we know that this is a laparoscopic procedure. So this is not what we're looking for. So that mesh is already bundled into that sling procedure here, because you already have that synthetic there as well. So all in all, what you need is your answer C, 51992. And I bet you rock this scenario. So great job, coders. Y'all are amazing today. And I think Miss Tracy has more scenarios for you. Take it away, Miss Tracy.
I do. Thank you so much, Miss Rochelle. Wonderful scenario. Okay, let me just grab the screen, and I have a couple more scenarios before we close it out for the day. Some more, let's see, hold on one second. Okay, here we go. Okay, so here is our scenario. We have A, 56620, B, 56625, C, 56630, or D, 56633. A 30-year-old stay-at-home cancer of the vulva. She will have a vulvectomy. The skin and superficial subcutaneous tissues were removed from 30% of the vulvar area. Which of the codes best describe the procedure? And you have a minute and a half, and your time begins now. All right, get those answers in. Okay. So let's go ahead and see. If I look at my answers, those all look pretty close together. So just have to kind of just determine what the differences are. Okay, so our answer is going to be A. Okay, 56620. And the keywords here are 32-year-old, stage 4 cancer, vulva, vulvectomy, superficial subcutaneous tissue, removed 30% vulvar area. Okay, so this patient had a vulvectomy, and these are all codes for a vulvectomy. So if we look first at 56620, this is for a simple vulvectomy, partial. So if we look at the definitions on page, you'll find this on page 391, and these all apply to vulvectomy codes. So it says a simple procedure is the removal of skin and subcutaneous, superficial subcutaneous tissue. Use this as your guide. It's going to be helpful because you might not really know what they're referring to in each one of these codes, and it's telling you the definition. Okay, it's saying what a simple procedure is, and that's the removal of skin and subcutaneous tissue. So looking up at my scenario, it says this skin and superficial subcutaneous tissue were removed. Okay, that looks pretty close to what a simple procedure is, right? So I like that code. Okay, and it also says remove from 30% of the vulvar area. Okay, so I'm just going to place a star there, and I'm going to look at the rest of the codes here. 56625 is for a complete, and oops, that would be, it says greater than 80% of the vulvar area. We only have 30% there, okay? So that's going to be incorrect. If we look at 56630, this is vulvectomy radical partial, okay? And that is, our keyword there is going to be that is going deep into the subcutaneous, and this is saying it's superficial, okay, in our scenario, okay? So that's going to be incorrect. And also vulvectomy radical complete 56633, that's also going to be incorrect, okay? Because we're just looking for a simple here. We're just looking for that keyword that matches skin and superficial subcutaneous tissue, and we have that there for our simple procedure, okay? So this is going to be coded as a simple vulvectomy, and A is your final answer, okay? All right, I got one final scenario for you all, so here we go. A, 54522, 54660, modifier 59. B, 54520, 54660, modifier 59. C, 54520, or D, 54522. A 28-year-old professional football player arrives at the ED with an injury sustained during practice. He was hit in the testicles and is experiencing intense pain. The ED physician contacted the urologist on call. After examination, the urologist diagnosed the patient with right testicular torsion and recommended that he have an orchiectomy immediately. The surgeon performed a right orchiectomy with implants. Which of the codes best describe this procedure? All right, I'm going to give you a minute and a half, and your time begins now. Good luck. All right, that is time. Go ahead and get your answers in. Okay. So looking at my answers, I noticed that A and D have the same first listed code, and B and C have the same first listed code. And then we have an additional code there in answer A and B, okay, with a modifier 59. Okay, let's see what our answer is. And it is going to be C, okay? Our keywords are 28-year-old, ED, injury, testicles, intense pain, urologist, urologist again, right testicular torsion, orchiectomy, right orchiectomy with implant. Okay, so our procedure here is orchiectomy, which is removal of the testicles, okay, or removal of the testicle, okay, in this case it's the right. Okay, so if we look at 54522, that is for a partial orchiectomy. And again, following those keywords, the right testicle is removed with an implant placed, okay? So it doesn't say that just partial, it just says the right is removed. So we have a right orchiectomy, so we wouldn't code this as partial, so it would be A and D would be incorrect. And if we look at 54520, that simple orchiectomy include subcapsular with or without testicular prosthesis, scrotal or inguinal approach. Okay, and then it says our parenthetical guideline says for bilateral, we're going to use 54520 with modifier 50. Only the right was removed, so we don't need a modifier in this case for that. So this, I like that code. Okay, now the difference between B and C is that additional code in B, 54660. So that is for the insertion of the testicular prosthesis. We don't need that. Why? Because first of all, it's saying it's a separate procedure. So we don't code it when it's integral to another procedure. And if we look up at 54520, this includes the testicular prosthesis, okay, when it's performed. Okay, so it's with or without, but we wouldn't code an additional code for that prosthesis because it's already included in that code language. Okay, so we can go ahead and we can get rid of answer B. Okay, and we only need that one code, 54520. So C is the correct answer. Okay. Alrighty, alrighty. How'd you do? Let us know in the chat. That concludes our session. However, don't go anywhere yet because we have to still reveal our winner. And next week, we will be covering, it'll be week 7, and we're going to cover the nervous system, eye, and adnexa. Okay, so stay tuned for that. That'll be next Wednesday, same time, same place. Okay, so 12 p.m. Eastern on Wednesday. All right, and it is time to reveal some of my favorite parts. The winner. The winner of our lecture series is dun, 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 Twyla Cleanse.
Woohoo! Yay! Yay! Woohoo!
Great job, Twyla. And Mrs. J, tell her how she can claim her prize.
Well, all you have to do is go to, hopefully you're here. And if you are, in the chat, there is a link just for you to click on. You click on it, it will take you directly to customer service, and customer service will put you in your course. Congratulations, Twyla.
Yes, congratulations. AMCI fabulous. Awesome, awesome. Thank you so much, Mrs. J. And do you want to win an AMCI lecture series? Do ya? Well, here's how you enter. Just comment on the video below and tell us what you learned in today's presentation. Yes, we want to know. Did you have some aha moments? Definitely share that with us. Sign up in the link provided in the live chat after the lecture. And we are going to announce another winner at the end of next week's session. So yes, yes, next week you could be our lucky winner. So just go ahead and sign up, okay? All right, and we also want to hear from you on what course you would like us to offer next, okay? And here's some suggestions. Would you like us to do a course on ICD-10-CM, maybe some PCS coding, HCPCS level 2, we don't use that book as often, or maybe modifiers, or if there's anything else that you have in mind, let us know. We are going to offer some more things, after we do this YT course. So just let us know, get those gears turning in our heads as well about what we can offer you. Okay, so we definitely want to be of service to you all. So let us know. Please share your thoughts on that with us. Thank you so much for that. And if you have any questions or if you want more information We do offer a wide range of services for coding. If you need CUs, you need a little bit more instruction, you need more basic instruction. I know this is more of an advanced course. We definitely have something for everybody. So you can contact our wonderful customer service department at www.absolutecodinginstitute.com, or you can also, if you remember this easier, www.amcicoding.com leads you to the same place. Okay, and please find us on Facebook, Absolute Medical Coding LLC, and we also have a medical coding exam group. Just type in AMCI medical coding exam. I can help. I can type it. I can share the link in the chat with you all. But it's an AMCI medical coding exam group, I believe. That's the name of it. But definitely find us on Facebook, and we want to have you as a friend. All right, and if you do like our instruction, please do like our video and tell everyone you know about us. The more people that watch us, the more videos we can provide for you all, okay? And I thought there was a, oops, maybe not. Sorry, thought there was a little example showing you how to like it, but you guys know how to like a video on Facebook. So definitely, we want you to do that. And we want to thank you all for attending today. You did an amazing job. Keep coming, keep participating, and keep learning. That's how you grow. So we definitely want you to come back week after week, and we definitely value your feedback. So let us know what you thought. And Mrs. J and Miss Rochelle, thank you both so much. Did an amazing job today.
Thank you, Ms. Tracy. You rocked that female reproductive system. Hey, coders, definitely like up this lecture if you like it, because you did an amazing job, outstanding, great job on the urinary system, Ms. Rochelle. I'm sitting back here so proud of you, and hopefully, coders, you all benefited from it because I certainly did. Outstanding job. All right. Great job to you, coders. Some of you are rocking it in the chat, and we just love it. Hopefully, we'll see you next week with our discussion of nervous system, and we're going to announce the winner of the lecture series. Thank you again, Ms. Rochelle and Mrs. Tracy.
Thank you, Mrs. J, and thank you to our other instructors out there helping us in the chat and providing such encouraging words. We have Miss Valentina, we have Miss Tiffany, Miss Anna, Miss Sarah, Miss Angela, Miss Jody. Thank you all so much.
Thank you. Thank you, AMCI family. You all are the best.
Take care. Bye, Mrs. J. Bye, coders.